I recently finished listening to the recording of a really great webinar talking all about chronic urinary tract infections. One of my colleagues, a fellow naturopathic doctor, put this out recently, and it was really, really well done. And so I've been kind of having chronic urinary tract infections on my mind lately since I've been learning about it lately. Chronic urinary tract infections, or CUTIs as they are denoted, are something that I've treated many times in practice over the years, and it was great to just have a little kind of like a very very nice, thorough yet concise research update around that. Hearing about his approaches was really great to hear, and it's just something that I think is important for folks to be aware of. One of the many things that he was presenting on was the fact that when standard urine cultures are done, like so you go to see your family doctor or your primary care physician, clinician, and they have got these symptoms. Let's see if there's a urinary tract infection. The culturing method that they use is, for all intents and purposes, stacked in favor of finding common microbes like E. coli, but it has a much harder time finding other harder to identify microorganisms like Mycoplasma or Klebsiella or certain other microbes like that. And so there can be these false negatives that will come up even though a person actually has this urinary tract infection. And if it goes untreated for a prolonged period of time, it causes prolonged symptoms. But unfortunately, those bacteria can actually ingratiate themselves into the space between the cells. And some of these microbes can actually make their way inside of the cell and become intracellular pathogens. So when a patient, say, say their doctor's trying to help them or their clinician's trying to help them, and they're like, oh, you don't have a urinary tract infection because the culture is negative, but maybe let's just try antibiotics anyways just to see how it goes, and that doesn't work. It's like, oh, well, I guess it must not be a urinary tract infection. Well, when the bacteria are able to get deep enough into the tissues, the antibiotics can't get in there, or they can, but you have to really marinate the bladder in these antibiotics for quite a long time, and most clinicians wouldn't know to prescribe for a longer period of time. Sometimes it might take months and months of being on antibiotics to fully resolve one of these infections. So clinically, it's really important to know about the limitations of testing, and then knowing to just being aware that chronic urinary tract infections don't always present in a classical kind of way. They may, quote unquote, just present with pelvic pain, or they may just present with sort of a burning sensation in the pelvis. There might, or just with quote unquote, just with frequent urgent urination, but without any pain or discomfort potentially. So there are different manifestations that could be apparent, and there can be other symptoms too. That's not an exhaustive list. So the take-home message is that if there are chronic pelvic symptoms, particularly if they involve urination or the bladder, then if one has not already been worked up for a chronic urinary tract infection, it's really an important thing to have on the differential diagnosis list. And there are labs that can be accessed that are able to do more comprehensive testing to look for these microbes, or what I oftentimes do in my practice, because the testing is fairly expensive. It's around $400 US to do this testing, so it's quite expensive, and for a number of my patients, just completely cost prohibitive. We'll do a therapeutic trial, and we'll say, okay, we may need to treat for a few months to really give it a good kick at the can, but let's start just megadosing the right antimicrobials, and while working with some symptom palliation at the same time. And oftentimes we'll start to see improvement, and oftentimes improvement is seen in less than 3 months time. Typically within 2 to 4 weeks of the right protocol, we start to see positive changes, but it may take a few months to really get at the nitty gritty. And then if there are biofilms as a component of that, it can extend the timeline even more. But anyways, that's a topic for another day. So I hope this information was useful. If you have any questions about this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.